Hi, I'm Michele McMaster and I'm one of the vets at McMaster Heap Vet Clinic. This is Maggie. She's an 8-year-old Border Collie Cross and she presented earlier in the week for an acute lameness in her right hind leg. Her owners had taken her out to the park and she'd run around and chased a tennis ball, caught it and immediately came back 3-legged lame. They were quite concerned about her. She just wouldn't put the leg on the ground, so they took her to the after-hours clinic on Sunday night. And they couldn't examine her, the leg was too sore, so they gave her morphine as pain relief and recommended she come and see me Monday morning. So this is a model of the knee, and basically the anterior cruciate ligament sits right in the middle of the stifle joint and it holds the joint tight and prevents lateral movement. So you can see that it's actually ruptured there. It should be sitting tightly in that groove, and when it has ruptured you can get movement in the knee like this, and that causes pain and instability and the dog won't want to walk on the leg. When I repair the stifle, I'm going to put some heavy gauge nylon suture around the fabella ligament. I'm going to traverse and go right through the joint under the patella ligament, and I'm going to drill a hole in the tibia, and I'm going to bring the ligament through the tibia, and I'm going to tie it quite tight at about 135 degrees at standing angle laterally on the side of the knee. So Maggie's in here today for her surgery. She's had her temperature, heart rate and respiration checked by a nurse this morning. We're going to pop a catheter in her soon and then give her her pre-med, which prepares her for surgery. Once she's anaesthetised, she'll be hooked up to our Cardell machine, which is an anaesthetic monitoring machine, which is really important to monitor heart rate, respiration, blood pressure. We look at her body core temperature, make sure that's okay, and it's just a really good tool for the nurse to make sure everything's going fine and that she's still okay for the anaesthetic. The surgery will take about 2 hours. Once the ligament is torn, you can't resuture it. So I go into the knee and I check the cartilage, trim out the torn ligament, and then place a lateral suture with heavy gauge nylon, which will stay in her knee forever and stabilise that leg and have her functional again.